Good morning, everyone. Myself, Dr. Pankaj. I'm pediatrician by profession and teacher by passion. Welcome you all in Pedia Academy by Dr. Pankaj. Today, we are discussing how to crack INI CET INI SS Neonatology examination in last 30 days. Okay, I'm not discussing any top secrets, but I am discussing how it can be done in last 30 days. Okay, so thank you for all your likes and comments in NEET SS recall series. We'll be starting neonatology series. We'll discuss in this video itself. Okay, so without further delay, let's start how to crack this INI SS DM in last 30 days. Okay, uh, when I say how to crack, basically it is how to optimize your preparation in last 30 days. If you are well read and even if you're not able to achieve this, there are some important areas I want to discuss based on my experience. Okay, so as all of we know, this is highly competitive and tough exam. Only 7 to 8 or you can say 10 seats are available for all India level. So neonatology and general peds has been asked basically some part of neonatology and some part of general peds. Generally they are overlapping. Obviously neonatology part has upper edge in examination. Okay, so what are the books? I will not waste time discussing book and resources. Nelson will be gold standard book for general pediatric topics and AIIMS protocols of neonatology will be main thing for neonatology. Okay, so I will be discussing the important principle on which I will discuss the further plan. Pareto principle. This says you put your 20% effort and results will translate to 80%. Okay, so according to this, focus on those 20% areas in from them which question are being asked and you get 80% of result. Rest 20% of questions or areas you can actually you can leave or you can solve by your journal knowledge or your knowledge around those topics. Okay, so I'm discussing which area you should 100% focus in neonatology. Okay, you can skip other areas, but these are very important. Okay, first prenatal area of neonatology, fetal assessment, CTG like stress test, risk assessment, intrapartum assessment, and antenatal corticosteroids are important. Just after birth, in these topic, NRP should be thorough. Birth traumas are actually nowadays being asked most importantly, where newborn findings like skin findings are generally being asked. General newborn conditions they ask twins, hypothermia, extreme low birth weight baby. Okay. In GI renal nutrition part of neonatology, they generally ask around breastfeeding composition and other things. Hypoglycemia, they are fond of asking. Hypocalcemia, neonatal jaundice, especially the neonatal jaundice updated protocol, NEC and ANH, antenatal hydronephrosis. So these are actually NEC is very important topic for them, you know. RS and CVS, respiratory and cardiovascular system, apnea, RDS, bronchopulmonary dysplasia, ABG, ventilatory grafts, shock, especially septic shock, PDA, and duct dependent lesions. Basically, these are bare minimum you have to learn, understand, and go deep into them. Hematology, polycythemia, and thrombocytopenia. In infection part, yes, TB, HIV, syphilis, and fungal infections and other torch infections are also important. In ortho part of neonatology, they generally focus on birth traumas as we discussed and osteopenia of prematurity. In CNS part, they are concerned on HIE, intracranial hemorrhage, seizures, tubular disorders, and therapeutic hypothermia. Eye and ear, retinopathy of prematurity, hearing loss, and others like umbilical cord banking, oxygen therapy, CPAP, HFNC, KMC, and like others others things. Okay, so we have discussed so many how we will do that. Okay, for that, I'm starting a series on this neonatology part where I'll be discussing fast track revision of neonatology topics in such a manner then that 80% of syllabus is covered. Basically, I will take these lectures on Pareto principle itself. I will try to cover 80% of stuff, very important stuff, okay, so that it get covered and you get good hold of neonatology in your exam. For journal part of pediatric, I'll be discussing what topics are important, but before that, just go through these Nelson table and flowchart discussion and Nelson images for NEET SS pediatrics. These are very important. I will be adding more Nelson based images and chart and tables in this discussion. So if you haven't subscribed to this or just go through these actually playlist and you are generally sorted for these Nelson part of pediatric part of this exam. Okay, hope you have given your NEET SS exam and you are well prepared for this general part. Okay, next, journal area, journal pediatric. What are area to focus? Okay, in general pediatric, as you know, it is vast, but some areas they are fond of asking, like growth and development, short stature, SMR staging, double habit milestone. In nutrition, SAM, rickets, micronutrients, breast milk, immunization, recent changes which are given in IEP, adolescent vaccination, catch-up vaccination. Okay, in pediatric psychiatry, behavioral disorder, learning disorder, they are fond of asking ADHD, autism, TIC. Fluid electrolyte AB is favorite topic of AIIMS examiners, and sodium and potassium they usually ask. Pediatric critical care, again very important. NALS and PALS protocol, you have the thorough. Shock, especially septic shock criteria they ask, and common poisoning they are actually AIIMS examiners topic. Genetics, oncogenetics, like what are the syndromes which are associated with oncology. Cardiogenetics, like in which supravalvular stenosis, AST, VST. Genetics along with cardiac disorders they usually ask, and diagnostic tests like chromosomal microarray, like karyotyping they usually ask. Metabolic in IM, another favorite topic of AIIMS examiners. They usually ask approach to IEM, porphyria and MPS. Immunology, they actually generally ask brief overview how you classify and how common features of SCID and other disorders. Okay, in infections, the HIV, hepatitis B, fungal infection, hot favorite topic of AIIMS examiners along with drugs. Respiratory infection, neonatal sepsis. Rheumatology, again, just go through my rheumatology videos, which are fast track for Nelson, where discussed JIA, MAS, SLE, nephritis, criteria, and neonatal lupus, JDM, and Kawasaki disease. GIT, they generally ask GRD, intestinal atresia, IBDs, cilia, cholestasis, Wilson, viral hepatitis, ALF. Respiratory, LTD group, asthma, ARDS, ventilation, and loop strategies. In CVS, they generally ask fetal circulation, CHT, AST, VST, TOF, RST, I, hypertension. In blood or hematology, they usually ask inherited bone marrow failure syndrome, hereditary spherocytosis, PNH, thalassemia, sickle cell disease, von Willebrand disease, coagulation disorder, transfusion. In oncology, important part of ALL like prognostic factors, Hodgkin's and non-Hodgkin's lymphoma classification, Wilms tumor, neuroblastoma, retinoblastoma, especially genetics and secondaries, nephroblastoma like congenital PSGN, AKI, CKI, Alport syndrome, RTA, tubulopathy, VOR, UTI, hypertension. Okay, and endocrine like diabetes insipidus, sexual differentiation disorders, hypothyroidism, man, diabetes mellitus, and CH, neuro. They generally ask anti-epileptic drugs, especially their side effects, congenital uh, abnormalities in CNS, autoimmune disorders, IAM in neuro, muscular dystrophies. Others, they usually ask biostats, 3 to 4 questions, skin, eye, ear, and recent development. So this was it for important topics for INI SS DM Neonatology. Okay, from my side, I'll be discussing Neonatology Fast Track Revision Series, which will cover almost 70 to 80% of syllabus. For general part, you can refer to my short, which are Nelson-based table and charts and images-based discussion. And I have given list of topics in which just see in, which topics you are weak in. Just go through with topic and this topic, and I'll be discussing much more in upcoming video. So upcoming video of NEET SS, INSS Neonatology series. So stay tuned, do share, like and subscribe. Till then, we'll meet in another